Hello, everyone. Thank you so much for joining us today. We're going to be getting started shortly, but first I would love to tell you about some upcoming webinars and courses here at the Center for Occupational and Environmental Health, and in partnership with the education and research centers around the country. On Tuesday, September 12th, we will be having I'm actually looking at the wrong document. My apologies. On Wednesday, September 20th, we will be having a webinar on workplace design considerations for the aging workforce. And this will be brought to you by Katia Costa Black, PhD and PT, the New York, New Jersey Education and Research Center. And on Wednesday, September 27th, we'll be having a webinar on unequal rights, the patchwork of state and local labor protections in the United States. And that will be with Kristen Harknett, PhD, and the California Labor Lab. We also will have another industrial hygiene webinar coming up on Tuesday, October 10th, and that will be with Dee Dee Montgomery, MS, CIH, and the Northwest Center for Occupational Health and Safety on what does total worker health have to do with industrial hygiene. So be sure to check out those upcoming webinars and more at our website at cueh@berkeley.edu/about-CE. And without further ado, on behalf of education and research centers throughout the country, it's my pleasure to present the Industrial Hygiene webinar series. This is a collaborative effort on behalf of each education and research center's continuing education program and aspires to provide access to current research supported through NIOSH ERC programs. We appreciate you taking time to join us today. Today's webinar, Community Engaged Research, Increasing Occupational Health Equity Among Historically Marginalized Populations, is brought to you by Shannon Guillot-Wright, PhD, and the Southwest Center for Occupational and Environmental Health. A few housekeeping items first. You will be muted during this presentation. If you'd like to ask a question, please enter it into the online Q&A box. We'll save time at the end of the presentation to address as many questions as possible. This presentation is being recorded and will be made available on the Center for Occupational and Environmental Health YouTube page within 5 business days. And you can also check back at the website where you registered. On all participants who logged in with their registration email for the full live presentation today will receive an email tomorrow with a link to an evaluation form that will qualify participants for a certificate of completion with 1 continuing education contact hour. Once the evaluation is completed, you will be able to access and print your certificate. And it is my pleasure to introduce our presenter for today, Dr. Shannon Guillot-Wright. Dr. Guillot-Wright is an associate professor at UT Health's School of Public Health and holds an affiliation with the Southwest Center for Occupational and Environmental Health. She is also the Director of Health Policy Research at the Center for Violence Prevention. Her program of research focuses on occupational health equity and the use of evidence in policy making with an emphasis on structural violence and social justice. She is particularly interested in understanding power, influence, and social change. Dr. Guillot-Wright's research with waterfront workers is grounded in community-based participatory research principles, and her methodology is ethnographic, including photo voice and digital storytelling. She has her PhD in Medical Humanities from UT Medical Branch MA in Human Rights from Columbia University and completed her postdoctoral training at the Edna Burnett Pierce Prevention Research Center at Penn State. Thank you so much for being here and sharing your work with us. We're looking forward to the presentation.
Thank you all so much for being here. So as you heard, we'll be presenting today on community engaged research. And what I really want to do is think about this more as a case study, because I know not many people work with waterfront workers. If you do, this is going to be amazing, and I am happy to talk to you even more. But I also think that what we're talking about here can be translated to many different populations. And so that's one thing that, as you're listening to the work that we're doing, I'm really trying to think about how it can impact your research and your work. So before I get started too far, I want to make sure I thank all of the amazing organizations and agencies who have funded this work. So particularly the Southwest Center for Agricultural Health, Injury Prevention and Education. They funded some of this well before we even had a lot of the results, and we're really grateful that they were able to fund some of the pilot work, and we're grateful that we're still able to work with them. And then I also want to thank the Center for Violence Prevention at UTMB, who also funded this. I also want to apologize if you hear whining in the background. My 9-year-old son convinced me to get a puppy last week, and so we are dealing with puppy love right now. So I just have to give that disclaimer. So today, what we're going to be talking about, first, who we are, what our collaborative and our lab focuses on, our research methods, because that's really important to what we do and how we do it, especially within a CBPR framework. We'll go into some of the research results in one of our studies, and then think about how that research then translates into action. So research to practice or research to policy. You'll hear some about our photo voice work. And so here, I just wanted to note that this was a photo taken by a participant that we'll then talk about a little bit later. So the Worker Health Equity Collaborative. So we started out here along the Gulf Coast to work with Gulf Coast workers. So we work all the way from Texas into Florida, and are really focused on trying to make visible an often hidden population of workers. And those are workers who work on the water. And so they're visible, they're invisible oftentimes because we just literally can't see them. And so one of our big focuses and our goals is to really make what they do and the work that they do more visible through research, advocacy, and policy making. And then, that mission is very much rooted in CBPR work. Excuse me. And the vision is to really increase health equity and social justice by listening to and responding to participant stories, as well as exploring how power is really preserved and constructed and used within these populations. So again, what we do research, qualitative research. We do photo voice, which is where we put our cameras in the hands of participants. And then we do storytelling. And so that is really focused on digital storytelling projects with our community members to highlight our screen. I've texted my husband to come pick up the dog. I'm extremely sorry. And then one framework that we have developed is, and hopefully you'll see this throughout the work that we do, is the See People framework. And so what we do with that is we are wanting to center policy and evidence, opportunity and power, and labor and equity. And so in all of our different methods that we're thinking about using and the analysis that we do, whenever we're taking that research into action, we want to make sure that we are centering those 6 issues. And then, of course, I want to give a shout out to so many of our team members who are part of the collaborative. I can't name everyone by name, obviously because of time, but I do want to just note a few people. Lacey Davis is our senior research manager. Her and Cecile, our Vietnamese interpreter, have spent countless hours at the docks, really building trust and rapport with our community. And so I want to make sure I give a shout out to them. Cecile is someone who we actually just kind of randomly met. We didn't, we needed somebody quickly. And so we were able to find her and work with her. And she immediately became part of our team and is now officially part of our research team. And so we're really happy about that and getting to work with her. And then we'll talk about the Dockside Clinic in a little bit. Martha Diaz is a nurse practitioner, and she has been the heart of that Dockside Clinic. And so I want to make sure and thank her as well. So getting into some of our research methods and theory. So again, we do community-based participatory research. And that research is a relational model that is valuing participants as equal partners in all phases of research. And so that doesn't just mean in the research to action phase, but it's even in the design of the research project and the questions that we are going to be asking participants in our survey designs, and then also into dissemination and implementation. So for example, we have one project that just got started underway this month. It's a 3-year project where we're going to be implementing community health workers, what we're calling healthcare navigators, throughout the different fishing communities. And before we even applied for that grant, we talked to different people within fishing agencies and councils, as well as some of the shrimpers who are out there working every day, trying to find out what it was that they wanted and needed when it came to injury prevention and when it came to occupational health equity. And in the first year of that project is really based in digging in even more into asking people what is it that they want to see through this program, and what is it that we need to be asking about and looking for, and the different services that we need to make sure that we're providing. So that's just one example of how that CBPR process really should happen, even before day one of the grant, that even the grant is written with participants and that research is done with participants. Sometimes that's hard to do at the very beginning, especially if you don't have pilot data, if you don't have connections. And so it can be, a journey. You can think of this as really long-term work, that, maybe the first project can't be fully CBPR, maybe it's just more participatory, where you're working with them on the research to action, but having that long-term goal of making sure participants are involved in all the stages is really what we're going for. And then we also do a lot of qualitative research. So we do have some mixed methods projects, but I'm an ethnographer, photo ethnographer by training. And so, that means that I'm going to be spending a lot of time getting to know groups of people and trying to really understand their lived experiences and, what their life is like on a day-to-day basis. And with that comes a lot of interviews and a lot of observation with participants. And our theoretical orientation to that work is to really think about power as transactional, to understand that power exists in these relationships and to not, pretend it away or will it away. And to go in with a very reflexive understanding that, I am who I am, I'm in this space and I can't necessarily change that. A shrimper that I'm working with isn't necessarily going to change who they are, but if we can both come into that shared space together and think about ourselves as meaning-making agents. So that means that we're both making meaning and that we're both influencing each other, and that I'm going to come in with a certain perspective and they're going to come in with a certain perspective. And instead of seeing that as a conflict, really seeing that as a starting point for discussion. And so, with that, you could see knowledge as being co-constructed, right? And so it's not me, the researcher, coming in and saying, look, slips, trips, and falls are a huge, issue in the shrimping community. And we need to make sure that you're wearing a personal flotation device, right? That wouldn't be a co-constructed process. And instead what we've done is we've gone in and said, are you concerned about slips, trips, and falls? If you're not, why aren't you? What is it you're concerned about? And how can we, work together to, solve some of the issues that you're concerned about in the immediate moment, and that could then also reduce something like a fatal or a non-fatal injury. So the participant set we worked with in this one research project that I'm going to talk a little bit more about in depth, just to kind of, again, give you sort of a case study and understanding of some of the work that we do. So over the course of about 2 years, we interviewed nearly 100 people, and we did this either through semi-structured interviews. So that means that you have your list of questions, but you can go off script. If they say something that's interesting that you want to dig into, it's not going to be like your typical survey questionnaire. And then we also did focus groups with a lot of participants. They were mainly Latino and Vietnamese participants, which I'll go into a little bit more in a minute. And then we also did photo voice. So photo voice is when you give a participant a camera and you ask them to take photos of what's important to them. One thing that's really important with photo voice is that before you ever, give that camera to somebody, you want to really have built some trust and rapport, because there's some different pieces to that where you're wanting to use photo voice sometimes in public settings. You want to make sure people understand that. And you also want to make sure that they're, understanding sort of the goals, that you have shared goals that you discuss, what it is that they, would want to be shared. And so what we typically do is after we've done interviews and built trust, we'll over administer cameras. So we'll give cameras out to quite a few people, knowing that we're not going to get all of them back. And what's important about that is within photo voice literature, the number of photos you have isn't going to necessarily be a quality issue, but it's really about the cameras that get returned and being able to do interviews with those participants and hearing why they took the photo and what that photo meant to them. That's really kind of the heart of what photo voice can be. And so in this project, we got 4 back, which we were super excited about, and we're able to do interviews with the participants. And then we've spent something like, over 200 hours at the docs. We, can't clock every hour perfectly, but we've done that by, some of that has been interviews and focus groups, but a lot of that has been, plopping down a camp chair and, just sitting and getting to know people before we even started trying to interview and to build trust. One of our, stories that we tell that kind of helps explain why that trust is so important. We were out at the docks doing interviews, and this was in Southeast Texas. And they were mainly Vietnamese fishermen, shrimpers. And after we had done interviews for, months, probably 2 or 3 months, we were out there meeting up with people, and we were done. We had gotten the interviews that we needed. We were still going out there for some other purposes, but as far as the actual interviews went, we were kind of closing up. And one of the guys came up to us that we had never seen before. And he said, "Hey, I've been watching y'all, and I think I'll go ahead and do an interview now." And we had never seen him. And so it was one of those realizations that people are watching us, even when we don't realize we're being watched, and not in a creepy way, in a really healthy way. And we have to, make sure that we are, honoring people and, really building that rapport and trust, and not just, going out there, doing interviews, leaving and never coming back, but really engaging with people on their terms. And so then our analysis, before we jump into the results, so we analyze a lot of our work through what we would call like the social structural context. And so with social, what we're thinking about is oftentimes cultural and interpersonal worlds. So people's family values, their relationships with coworkers. And then with structural, we're looking at the political economy. So that might be trying to understand the price of shrimp imports and how that impacts people's decision making. Looking at diesel prices, regulations, or maybe the deregulation of certain industries. And so we're oftentimes, when we have all of these interviews and these transcripts, we're looking at it through that lens. So our participants. So what we ended up, where we ended up working was in 2 cities along the Gulf Coast in Texas, or 2 regions, I should say. One was Southeast Texas, and then one is the Rio Grande Valley. So in Texas, I'm sure you've heard the Rio Grande Valley in the news lately. It's right on the Texas-Mexico border. Almost all of our participants were Latino. They were usually on an H-2A visa, or were trying to get an H-2A visa. Almost all of the participants were male that we worked with. And many of them, if they weren't shrimping, might go over the border to get healthcare access, or to stay in their homes. And that was something that was a little bit more typical of that group. In Southeast Texas, you have people more along the border of Texas, kind of going into Louisiana, and that's mainly Vietnamese refugees who came over back in like the late 70s, early 80s, and many settled within the East Texas, Louisiana region, and have been shrimping for quite a long time now. And so almost everyone in that region was Vietnamese, also mainly males. For them, it's not so easy just to go along the border and go home for a couple weeks. And so we saw a lot of homelessness or unstable housing. So about 30% of the population either lived seasonally unhoused at the docks. They were living under travel trailers, and they were living in broken down cars. Sometimes they would get to sleep on the boat if the captain allowed them to. But that was kind of the makeup of most of that population. So the themes that we saw through our research, let me go back to that, was assessing risk, access to healthcare, and then psychological distress. So accessing risk. So what we saw was that many of the shrimpers had a very keen understanding of the danger and the injuries that they might be susceptible to. And so shrimpers or commercial fishermen generally have almost 30 times the fatality rate compared to any other industry. So it's one of the most dangerous industries out there. And then Gulf Coast shrimpers are a particular danger and at risk for non-fatal and fatal injury. And many of them knew this. This wasn't, any kind of like surprise of, telling them that their work is dangerous. But most of them really saw it as unavoidable or inherent to the work. And then here is a photo, just so you can see that's a trailer. And underneath that, you can see some tents where some of the guys would live. So what we heard from a lot of the shrimpers was that people would say, we never told anybody, but so many people die. So today I'm going to tell you, so many people died because of these hazards. Nothing is safe here. And the same person we asked, so do you wear a flotation vest or a personal flotation device, a PFD? And they'd say, we can't work with it. It's hard to work with wearing one. Another person in the Rio Grande Valley told us, all jobs have risk. This one is just a lot more, but this is the type of jobs the majority of immigrants have to get. That's just the way it is. We said, okay, but what about earlier when you said you had to climb out, when you hurt your finger, were you wearing a life jacket? He said, no, we don't use them because you can't do the maneuver with a vest on, and we're carrying tools and you just can't. Again, do you wear a life jacket? No, he smiled. There's nothing we can do in those. And this was an interview, one of our photo voice interviews, when he was showing us different photos that he took. And there's a photo of him leaning over the boat, trying to catch a fish with his bare hands. And, he said, no, I didn't wear a life jacket. Then, I normally wouldn't. This person said, a lot of us only speak a little English. We don't understand a lot of the technology. If there's a device that could help us, we don't know how to work it. So again, here's another danger, that's related to, that a lot of the rules and the regulations are going to be presented in English. Most of the Coast Guard guys that we met out there, many of them were really sympathetic to the shrimpers and wanted to help them. But most of them also spoke English. And so that was a huge barrier that we saw within the safety and health and danger risk. So then access to healthcare. So this also is a huge issue that we saw, that little, if any, access to healthcare in the US, mainly because of expense, also because people, maybe had lost documentation, maybe didn't have documentation, maybe it was stolen or it fell in the water, limited, services in Vietnamese or Spanish, especially in Vietnamese. And so there was a huge lack of access to primary care. When it came to emergency care, that was something that people had a little bit more access to. But specifically with primary care, there was limited access. So here we asked, are there any other things, like when you get sick, is there anyone besides the Coast Guard that can help you? And one of the guys said Bud Light, and everyone laughed, we laughed. But also, I don't know if at the very beginning there was a photo, and I can go back to it when we're done, but there's a photo of our nurse practitioner, taking the blood pressure of one of our guys out at our clinic. And you see, a huge case of Bud Light and like a handle of liquor right next to him as he's getting his, blood pressure taken. And, that's really the conditions that we're working with, when we're out there. I mean, when we say it's field work, we're literally out in fields, working with a lot of the participants. And there is, a lot of self-medication when it comes to alcohol, drugs, opioids. And so although this was said in a joking manner, it's also very telling that whenever you have a lack of access to healthcare, and when you're in a very physical job that is very dangerous, what often happens is alcohol and drugs become a form of self-medication. And so that's something that, we're trying to work on through some other projects as well. This person said, I lost all my teeth in a crash. My nose was cut open and everything in my mouth. I didn't want to call the Coast Guard. The boss wanted me to return to land, but I needed the money. I needed to work. So I put up with it at sea with pills for pain and infection to handle the trip. So again, we start to see this kind of precariousness, right? When it comes to being injured, but also needing to work. So this lack of sick leave benefits within, the industry and within, the H-2A worker visa program, kind of on a whole. We've also done work with H-2B visa workers, and we see similar stories of working through sickness, working through pain, working through injury, just so that you can make sure to get paid. Because, if this person had gone in, he likely, maybe would have gotten a little bit the few days he was out there, but probably not. So here, a shrimper said no. He was talking about some of the guys that he works with. This was a captain. He said a lot of the guys make money, but one thing, they don't have an ID. They lost their IDs, a green card. They have no car, no transportation. They can't go anywhere. They're nice, they're good people. And this was in the context of him asking if we could help provide different social services like housing and healthcare for a lot of his dock workers. And then the last result that I'll go into is psychological distress. And so what we saw was a lot of mental health issues stemming from loneliness and this limited access to housing and healthcare. I don't think anyone actually used the word mental health. And so that's also why we call it psychological distress here. But, we can look at it through our different lenses and medical lenses and healthcare lenses to kind of see what was going on there. So this shrimper told us it's different for us because the majority of time we are surrounded by and out in the water. It's as if you were in jail. This person said, yes, it's hard on the family when you leave, even more for my little one. When he comes to say bye to me from where we are, he starts to cry. He's 6 years old. It's tough. All your life at sea, not seeing the kids grow up or anything. And we also do a lot of work with seafarers, cargo vessel workers, and we hear a lot of these same stories of, being away from your family for such a long time and that sacrifice, but feeling like, that's your only option to make a decent amount of money to send home. This person said it was difficult to get used to this way of life, physically, mentally. I think the biggest problem is in the head. The Americans say you're homesick because that's what hurts the most. We don't see our kids. We don't see our wives. So what I want to now kind of move into is thinking about what we do about this. So, we talked about, our methodology, our theory, our, analysis methods, and then our results. And oftentimes what happens is we have these results and, they can be depressing, they can be frustrating, they can feel overwhelming, and we'll publish them, I'll talk about them in different webinars, and the research to action, side is oftentimes kind of left wanting in a way. And so what we really try to do with our lab and our collaborative is to think about research to practice or research to policy. So in this particular example, it's going to be looking at research to practice. So how do you take something like these stories and there's these narratives and then move it into a way that really works with and collaborates with the community to make positive change? So I'm going to show a quick video and then we can kind of open it up here.
Dạ được. Bây giờ chích luôn đi, người ta sẵn sàng kìa. He wants to get the shot, but he's coming right back. My name is Guillot-Wright, but everybody call me Cecile, and I'm Vietnamese interpreter for this project. Yeah, at first we came out just to learn about the fishermen out here, what they do.
So I'm Shannon Guillot-Wright. I am a researcher at the University of Texas Medical Branch, and we've been working with the Gulf Coast commercial fishermen and shrimpers for over a year now. We're doing community-based participatory research that really is about coming out here and talking to people, hearing what they need, and then responding to that.
Most of them don't have insurance, health insurance, so they never have not seen a doctor like in years and years and years. And so they're very interested in finding out what's going on with them, whether they have sugar problem or blood pressure problem.
After talking to the shrimpers and hearing about what they needed, we decided to start a free clinic in July. It was supposed to just be a one-time large clinic, and we were offering antibiotics, diabetes screening, being able to see a physician on site.
Now we come out once a month, first week of the month, to give people COVID shots and whatever they need. I remember we did give them some pain medication for their joint pain, knee pain, and so here we are again for this month.
The fact that we are now coming out here, so the July clinic was supposed to be one time, we're now coming out here once a month. I think it's really evident that something like universal health care in the US is needed, and it would greatly benefit so many people who are putting food on our tables, and we are not providing benefits back to them as a society. And that's something that I think has been really evident as we've been coming out here every month for the past year and wanting to make sure that we change those systems as well. So as you'll see, and the reason I wanted to show that, I just think it's a really easier visual to see some of the work that we've been doing with the fishermen. When I say fishermen, that includes shrimpers, crabbers, different populations. And what for me is really important about this clinic is I wish I could say it was my idea. I wish I could say I was laying around asleep, not able to sleep at night, trying to think, what can I do? But it was the idea of the shrimpers. It was them telling us, hey, we don't have, I have this eye infection and I don't know what to do. I have a bill and I don't know how to get it paid for. I have, blood problems, how do I get medicine? And sometimes it was even just that they might know where to get the medicine, but the physician might only prescribed 30 days from medicine, where a fisherman is often going to be out 30 to 45 days. So it was being able to have, like an intermediary, Martha, who I mentioned earlier, nurse practitioner, being able to, say, no, we need to make sure they get 2 months of their prescription, right? And so little things like that. And so we now go out once a month. We're still doing this. We just had our clinic this month, and we've seen, over 300 people through this clinic. It's now expanding into 2 different locations through funding with the Southwest Ag Center. And then we're also going to be implementing community healthcare navigators throughout some different locations along the Gulf Coast through funding from NIOSH, National Institute of Occupational Safety and Health. And so, this work, again, thinking about community engaged research and community led research, that, it was really about listening to some of the issues they were having. I don't know if in some of the photos or videos you could see, but there's this huge healthcare system that kind of like literally surrounds the docks, and you could, see it out a window, from a hospital room. You could see, the shrimpers out there unloading shrimp, and yet they didn't have access to that clinic that they could, probably throw a rock to and hit. And so, that was one thing of being able to go out there and then think about that sustainability as well. So, we were able to get it funded. We were able to show that this is something that works. And now different, healthcare systems and FQHCs are partnering with us so that it's not, just, solely, based on grant funding, but it's something that can, be sustainable and continue long term. So that's one example of, being able to do this research, hear these narratives, hear people's stories, work really close with them, build trust, and then, take that and translate it, into something that can be really powerful. So I would love, I know I'm kind of done a little bit early, but I would love to take questions if that's okay, and hear what other people have to say.
Absolutely. Thank you so much for your presentation. At this time, if you have a question, please do go ahead and enter it into the Q&A. We have plenty of time to really dig in and discuss. So a first question that came in, how can manufacturers of life jackets help with the issue that they are hard to work in? Can a design change encourage use, and can it be done affordably?
That is a great question. Yes, the answer is yes. The affordability, I'm not sure about, but manufacturers can definitely engage in this process. So a few years ago, there was somebody who created, and basically like when you see a surfer, like the, like a wetsuit top, or, but not even that thick, just like a sun shirt almost, that has a cartridge in it that you can either pull manually and it inflates into a life jacket, or there can be a cartridge that right when it hits water, it would inflate. So for someone like a surfer, they might want the one that they pull since they're clearly in the water a lot. Whereas a fisherman who, isn't going to be jumping in bodies of water, but if they do fall overboard, maybe hit their head or unconscious, it would, inflate for them. So that's something that just recently they were able to get Coast Guard approved. So this is another, issue that, there are different life jackets out there that aren't as bulky, but if they're not Coast Guard approved, then there's no, point in really spending the money, for what the fishermen see, because they have to have a Coast Guard approved one on there. And so that's something that we have been interested in, thinking about getting to fishermen to maybe study, would they actually wear this? When we asked, a lot of the shrimpers if there wasn't a bulky one, would you wear it? Some of them said yes, some of them said no. But that's also because maybe they, can't imagine what a non-bulky life jacket, might even look like. And so the problem with it is that it is extremely expensive. So I think, like anything with, market-driven work, that, the more of these types of options that are available, the price starts to drop, right? And so I think anytime you get more people manufacturing something that isn't as bulky, I definitely think that that's something that could help move people wearing it, especially in the Gulf Coast where it's extremely hot in the summer, and most of the shrimping happens in the summer. And so, having something that's as thin as like a sun shirt could go a long way, and it could help protect them from the sun, because we also see a lot of cancer within this population. So, really great question.
Awesome. Thank you so much. Kind of tangential to this question, we do have an upcoming webinar on design and safety and sizing considerations for personal protective equipment. It's one of our ergonomic webinars coming up on Wednesday, October 18th. I don't think that we're going to be addressing life jackets in that webinar. However, it is kind of looking at the safety considerations of the design of personal protective equipment and how that may or may not impact the use and the utilization of that PPE. So another place to check out, kind of in alignment with that question.
Yeah.
Awesome. Another question, what is the incidence of opioid use in this population versus the general population? And is Narcan readily available?
Another great question. Y'all are on point. So it has, within the Gulf Coast, it hasn't really been studied much on incidence rates. We do know in the Northeast, it is a pretty high rate of opioid use. Again, because a lot of the factors we talked about. And what you can look at is it's not necessarily just fishermen. So I think this is when you can think about lots of different populations that we all might work with. And what you see is that people who have heavy physical jobs with limited sick leave benefits and really dangerous work, that combination of those three issues are going to be an increase in opioid use. So I think within occupational health, generally speaking, starting to really understand opioid use and self-medication and even just substance misuse on a larger scale is something that I know is being talked about a bit more. And I think there's more funding that's being kind of funneled to that work. With our one of our recent grants that we got from NIOSH, the Community Health Worker Grant, we'll be looking at substance use in particular, and using what we call motivational interviewing, so that it's a technique that you might use with somebody. So instead of saying you should stop drinking, which it's like, okay, yeah, like you shouldn't drink when you're on the boat. But instead of that, it's, would you consider only drinking 5 beers? Or would you consider only drinking, when you're not out on the deck, where it's more dangerous, right? And so it's that idea of, can you start to make kind of incremental change with a long-term strategy instead of just, kind of like telling people to quit cold turkey. So that is something that we'll be looking into more, and I hope I have some results I can present in a year or so. And then the Narcan question, I have not seen it readily available. Our research team did get trained in it, and we do have it available. But we have it that we could hand out to fishermen. We haven't done a Narcan training with the fishermen themselves, but I think it's a great idea. And it's something that should definitely, be done and be a larger focus within any of these industries. Again, like I said, that have those different risk factors.
Thank you so much. We also have a comment kind of tied to the previous question, just acknowledging that they have similar challenges with wearing safety gear when working with lobster fishermen in Nova Scotia, Canada. So thank you for that comment.
Yeah.
Another question, are fishermen and shore workers directly employed, or do they tend to have contract relationships?
So it depends. I would say in Southeast Texas, it's probably not a contract. It wouldn't be what you think of as like a typical contract that somebody would sign. It's a deckhand who might be hanging around and they get hired by the captain. Obviously, that creates a lot of space for even more exploitation. Because you don't have much, if that captain happens to be a captain who isn't great, you could be stuck out on the water with them for 30 to 45 days. But what we've seen at least in the Southeast Texas region, is that, if somebody is, a captain who they would call a bad captain, they typically aren't going to they're going to have a harder time getting deckhands. So there is sort of that, that piece to it that can help a little bit, but there isn't a contract per se. They get paid in cash because many of them don't have bank accounts. And so they'll get paid after that. Haul, it can be anywhere. Again, they're out for 30 to 45 days. It could be anywhere from like average 1,000 to 6,000 that they'll get for that haul. So, many of them are working sometimes 24 hours around the clock. So, you can kind of do the math on an hourly rate. One guy told us that he came back and he was ecstatic and happy when we interviewed him because he had just had like a $15,000 haul, and he said he's only had that like once in his life, and he was in his 60s. So that's definitely like on the rarer side, but it does happen. But the average would be 1,000 to 6,000, and then in the Rio Grande Valley, and so the workers who are on H-2A visas, there is more of a contractual agreement there. And so they're typically on that visa 6 to 9 months. And the H-2A visa is an ag worker visa, so it's not a pathway to citizenship, which again creates different layers of exploitation as well. And then there's also the H-2B visa, very similar type of contractual requirements, and there's a few differences, but the H-2B is anything that's non-ag, typically in like the tourism industry. So a seafood processor would be H-2B, and like a hotel guest worker would be H-2B, whereas farm workers and fishermen are H-2A.
Thank you so much for providing that clarification. Very helpful. Another question, do you foresee that community-based organizations will bring a greater participation of high-risk migrant workers to bring about change in social health and the workplace?
Yeah, I would say researchers working with community organizations is really something that you're seeing a lot more of and is much more powerful. And I actually came from the nonprofit community world, into research. And so I think my orientation is probably more towards that community advocacy side just naturally, because that's what I did for many years before going into academia. But I definitely think the more community organizations that are coming together to respond to and elevate the voices of immigrant and migrant workers is where you're going to see a lot of that change, where workers have the space, and the protection, right? That they can, speak up and talk about a lot of, some of the, either exploitation that they face, or even just, the really dangerous conditions that many of them have to work in. But yeah, I think anytime we can work with community agencies, we're going to be better for it.
Excellent, thank you. Has there been any look at crab asthma or other industrial hygiene concerns or atopic personnel?
I haven't, but I think that that's something great that, anytime we can look into, more of what people are dealing with and facing. But yeah, I'm not sure. I cannot answer that question in a meaningful way. I apologize.
Oh, great. Thank you. Are you also able to share what are some of the safety measures put into place by these fishing companies to ensure the well-being of their employees?
Oh, that's a good question. So you're going to have less companies, at least within the Gulf Coast, shrimping industry, and more like boat owners, and sometimes the boat owner may also be the boat captain. And so the boat owner, might have one boat, might have, a fleet of boats, maybe 2, 3, 5, 10 boats. And a lot of what they're doing is, kind of very basic, like putting sand into paint. So if, on the deck, if you slip, you're less likely to slip if there's sand into paint, right? Things like that. I would say it's probably more like Coast Guard driven, of ensuring that there's proper safety and protocols and regulations, and that they're following those regulations, like having a personal flotation device on board, or they also have to have like a life ring that they could throw out, different factors like that. A lot of these boats are really old. Some of them are really low, and so it could be really easy to fall over. And there's a lot of different things that can fall and hurt. People, nets and boxes. One of our photos we got back, the guy actually, the photo he had taken of the shrimper, a couple hours after he took that photo, a box from a net had fallen and hit his head, and started seizing. The Coast Guard had to come get him and life flight him out of there, and he ended up living. He was okay. We saw him a little bit after that, but something like that, that's almost routine in a way, where a lot of fishermen have those stories. I also want to just note, I've been saying fishermen, and I want to the reason I say that, it's a term that's considered gender neutral within the fishing community. And so if you use the word like a fisher, and there's a little bit more reluctance to maybe to talk or to listen, because the term even that women will use is oftentimes fishermen. So I just wanted to make that note of clarification.
Thank you. We also got a note. Thank you for your excellent response on CBO. And another question, during the period of your study, did you have the experience of the fishermen commenting on fatalities on shrimp boats, or anything being investigated by federal OSHA?
So did we have fish? Can you repeat that? I'm sorry.
Sure. So during the period of your study, did you have the experience of the fishermen commenting on fatalities on shrimp boats being investigated by federal OSHA?
None of them talked about investigations. We heard, quite a few stories of people who were, greatly injured, or, did, maybe typically fall overboard, and they weren't found. That's a huge reason for the fatalities. But there's an interesting reluctance to kind of work with or talk with federal agencies, even the Coast Guard. There can be a reluctance. And so there's, even with some of the guys that we worked with at the Coast Guard, who are, part of the Coast Guard, they would have to spend a lot of time building trust, because they were seen as federal agents. Oftentimes it's seen as like, you're just going to come on board and write me a ticket, and not do anything to actually help us. It's sort of the view. And so we oftentimes we would even have to state, when we were first getting to know them, like, we're not with the federal government, we're not here to look to see if you have the right PFD or not. We're just here to talk to you, to understand your experiences. So that wasn't something that we necessarily got into, or that a lot of the shrimpers talked about. It's a great question, though.
Yeah, thank you so much for providing that information, that context for us. We have another question. Do you see any opportunity to influence state or federal policy about work protections for H-2A workers, or within the maritime safety industry?
Yeah, so there's been a lot of good work done within, and I would say like H-2A, H-2B, sometimes it gets lumped together a lot of times. That a lot of different, especially immigrant rights organizations, have been working to kind of dig into some of that policy. I didn't present about much of our research to policy work here, but we also do a lot of research on the use of evidence within legislation. So I've worked with U.S. congressional members, members of the state legislature, to think about different policies that we can push forward for our workers. And we were part of the Department of Labor's, and they had something called a listening session not too long ago. I've testified before the Texas legislature. And what we've seen with the H-2A program in particular is that sick leave benefits are a huge issue, or any like leave benefit. And so being able to take a day off and get paid for it would greatly reduce, injury and, even like during COVID, we saw, huge spikes of, COVID within, industries where people couldn't take off within like meat packing and seafood industries. We did some research there. So sick leave benefits, and then a pathway to citizenship is also something that's really important. If, a lot of times people talk about, they, come here to work for 6 to 9 months, and then it's hard to get a stable job when they go back to, let's say Mexico, because, their employer knows that they're going to be leaving in 6 to 9 months. And so, not being able to work in the US outside of that 6 to 9 month range can, create a lot of issues. It can also create exploitation. So another H-2A visa policy that we've been pushing to get changed is that if you come here to work with one employer, that you should be able to leave that employer to work with a different employer. Because what happens is, let's say you came here to work for, Guillot-Wright's lab, and I am not paying you fairly, I'm not letting you leave, I'm, exploiting you, maybe not to the extent of, labor trafficking, but definitely exploitation. If you leave, you can't then go work for the Temple lab, right? And so you would, if you, now you can, and H-2A workers do have access to labor rights laws, and they can, file complaints, and they do still have access to that, but oftentimes, that's not known, or, it can be pretty daunting, a huge task, pretty scary. And during that investigation, you might not be able to work. So that's another issue within H-2A policies, that I think those 3 issues, sick leave, pathway to citizenship, and then being able to work for a different employer under that same contract would be really helpful to increasing healthcare rights.
Thank you so much. Absolutely. I appreciate that feedback and that laying that out for us. Just a note that it appears that immigrant fishermen have similar social and workplace issues as agricultural workers. And so a lot of these issues kind of span agriculture and fisheries. So thank you.
Yes, definitely.
Another question, how do you recommend we apply this approach in private companies?
The approach of community-based participatory research?
That is how I interpreted the question, yes.
Yeah, I think that it goes to any company, right, or to any population. It's really about, building that trust and access. So a lot of my research, I kind of mentioned I do research with policymakers, right? So that's a completely different, type of population, where you're clearly not going to like set up a camp chair in the hallways of, the state capitol. But it's really about building relationships at the end of the day. And so I would say that's the foundation to any of this work, is how do you build and maintain relationships with decision makers, as well as the participants that you're working with. And so, and that could be one and the same, or it could be different depending on the industry. But, I think definitely no matter what industry you're looking at, you can think about, how can you, really kind of dig in and get to know the issues that people are facing.
Thank you. I guess we have time for one more. Someone noted, I see a dog. What are your thoughts on having dogs and cats during such health initiatives to help with mental health? Any collaborations with animal shelters?
We have not collaborated with animal shelters, but yes, there was a dog. One of the women who is at the docks quite a bit had that dog. And I'm all for anything that works. And so I think that if you can collaborate with groups, and that's something that can, help, especially mental health, then I'm all for it. Other than getting a new puppy right before a presentation that keeps barking. That would be my only advice.
I will say I didn't really hear the dog during the presentation, so I think you're good.
Great.
Although I would have taken seeing him. No. Do you have any kind of closing thoughts or anything you'd like to share as we wrap up today?
No, I think all of these questions are so on point, and it just goes to show that I'm really excited the way that occupational health is moving. I think as a field, that people are really thinking about how we make workers safe in different ways, and I am always happy to take questions if you want to reach out by email or collaborate or think about ways that you could use this type of research in the industries that you work with. I think all of us working together makes it even better. So I'm really happy to talk to everyone, and I hope I get to know some of you on the other side at some point.
Excellent. Well, thank you. Thank you again so much for joining us today, for sharing your expertise, your experience with our crew here today. Thank you to all of you online who joined for the webinar. Be sure to check out our website and to register for upcoming webinars at coeh@berkeley.edu/about-CE. And as a reminder, you'll get an email with the evaluation, and that'll qualify you for a certificate of completion. So thank you all for being here, and I hope you enjoy the rest of your day.
Thanks all.
Bye.